Let's take a step back to understand the history of Florida's Medicaid waiver. This unit will explore the origins of institutional care in Florida, the evolution of disability rights and legislative reforms, the current challenges and opportunities for system improvements. Understanding this history will provide context for today's funding challenges and policy discussions. In the early 1900s, individuals with developmental disabilities were placed in large institutions, often under inhumane conditions. Families were advised by doctors to institutionalize children, believing it was the best option. Many institutions lacked proper medical care, education, or rehabilitation programs. Over time, public outcry and disability rights advocacy led to major reforms. Today, Florida prioritizes community-based services over institutional care, but challenges remain in ensuring adequate funding and accessibility for all. In 1921, Florida opened the Florida Farm Colony for the feeble-minded and epileptic, an institution later exposed for severe abuse, a tragic example of how individuals with disabilities were segregated instead of supported. In 1965, Medicaid was created, but it didn't fund home and community-based services, leaving families with little choice beyond institutional care. Today, only 2 state institutions remain, Takashale and Sunland, but they no longer take new admissions. This is progress, but our work isn't done. This period marks significant policy shifts. 1981, the federal government created Home and Community-Based Services, HCBS waivers, allowing Medicaid to fund community supports instead of institutions. 1990, the Americans with Disabilities Act, ADA, was passed, prohibiting discrimination against individuals with disabilities. 1999, the Olmstead decision ruled that states must offer services in the least restrictive setting possible. 2000s, Florida expanded waiver services, but demand continued to outpace funding, creating long wait lists. These reforms were crucial in transitioning individuals out of institutions, but they also introduced new challenges in service accessibility. In 2004, Florida created the Agency for Persons with Disabilities, APD, separating it from the Department of Children and Families. This was meant to signal a stronger commitment to community-based services, but APD inherited a multi-million-dollar budget deficit, setting the stage for long-term financial struggles. By 2006, funding challenges led the legislature to cap waiver enrollment, restricting new services to crisis cases only. The result? The waiver wait list kept growing, from 14,000 in 2004 to 25,000 by 2005. In 2007, APD restructured Medicaid waivers into 4 tiers, but instead of solving funding issues, it reduced services for many and led to lawsuits. By 2008, the Great Recession caused Medicaid cuts, further delaying new enrollments. By 2009, APD was sued for violating Olmstead v. LC, a landmark case requiring states to provide community-based services instead of institutionalizing people with disabilities. Long wait times for the waiver were at odds with federal law. In 2010, a state audit of APD finances exposed poor budget forecasting and service shortfalls, reinforcing what families already knew: the system was failing to meet demand. In 2011, Florida introduced iBudget Florida, an individualized Medicaid waiver system designed to give people more control over their services while capping spending. But while self-determination was the goal, budget restrictions soon became a major issue. By 2013, Moreland v. Palmer challenged the rollout after individuals' budgets were reduced without notice or justification. The lawsuit led to the reinstatement of 6,000 individuals' budgets, ensuring people didn't lose services without due process. Also in 2013, APD was sued again in Wheaton v. APD for delays in approving additional funding requests. The settlement forced APD to follow federal timelines, improving response times for urgent service needs. In 2014, advocates challenged iBudget's funding formula, proving that many individuals were being underfunded by the system's algorithm. This resulted in 14,000 budget increases, ensuring people received the full amount they were eligible for. By 2015, advocacy led to expanded eligibility, adding Phelan-McDermid syndrome to the waiver and prioritizing youth aging out of foster care. This marked a shift toward proactive and equitable access, a huge win for Florida's disability community. In 2017, Florida expanded CDC Plus enrollment, giving more individuals the ability to self-direct their services. This was a step toward greater flexibility, but systemic funding issues persisted. By 2018, Florida's iBudget waiver faced a major funding gap. Though $1.1 billion was appropriated, actual costs exceeded $1.2 billion, leaving a $56.9 million deficit. This underscored an ongoing issue, demand far outpacing funding. In 2019, a 3% rate increase was approved for adult day training, ADT, adding $1.9 million to the system. But this was not enough to address the severe workforce shortage. Providers continue to struggle to recruit and retain qualified staff, leading to service gaps and reduced access for individuals with disabilities. Then in 2020, the COVID-19 pandemic disrupted everything. Emergency measures like telehealth expansions helped temporarily, but families still faced massive disruptions in care as providers shut down and services became harder to access. The pattern here is clear. Incremental funding increases are not enough to meet the needs of Florida's disability community. Without real investment in providers, workforce stability, and service expansion, families will continue to struggle for essential care. In 2021, Florida required APD to provide written information on disability resources, ensuring families received updates on services and benefits. In 2022, the state funded an $8.5 million dental program for individuals with developmental disabilities, expanding much-needed care. In 2023, a federal court ruled Florida violated the ADA by keeping children in nursing facilities instead of providing home-based care, ordering the state to expand community options. In 2024, key reforms improved access, an online waiver application, faster crisis determinations, a lower caregiver age, and $39 million for the Medicaid workforce. These changes happen because of advocacy. Progress is ongoing, but we must keep pushing for better services and support. A data-driven look at the growing demand for waiver services. Graphs illustrate the increasing number of individuals on the waiting list and the urgent need for funding adjustments. This slide shows trends in Florida's population growth and waiver demands, emphasizing the need for proactive policy planning to address sustainability. What department initially handled developmental disability services before the waiver system was created? The Health and Rehabilitative Services, HRS department, originally managed developmental disability services before transitioning to APD.